I say this with the most respect because I've known thousands of doctors over many, many years. Because the first time I was in a hospital learning was 1977. And I looked and I listened and I thought every answer that the patients were giving in the oncology ward, in the heart ward, in the ICU, every answer they were given was a drug, was a drug. And I thought, nobody is asking any questions. So diplomatically, as a young training person, took one of the physicians aside, who was actually the head of the department. And I said, people come in with a diagnosis of something. All of a sudden you're doing CAT scans and PET scans and all these tests, which doesn't tell them anything. He said, but that's the standard of care. So the reason why a medical professional doesn't get to the root cause of your issues, because they're following a standard of care for which they are corralled, because the risk of them losing their license if they get outside the standard of care, which directs them into PET scans, CAT scans, x-rays, surgeries, biopsies, poisons, chemo, drugs, whatever. All those things are dictated by the American Medical Association, which then dictates what they're able to do. So it doesn't mean a physician is ignorant. It means they're fearful with their license and their income and their way of making a living. If they deviate, it doesn't matter that it doesn't help you. What matters for them is if they deviate at all, they'll be kicked out of their profession. Think about the fear of that.